coming. I hope we have a good debate today, and let's get right into this. Um, so, the government team believes that we can save lives for now and the future if Africa is provided the infrastructure necessary to fight the diseases it may face. So that brings me into the resolution, which is the U.S. military is to respond to the Ebola crisis. So, observation one, subpoint A, the government reserves the right to define. We define this as a policy debate because respond implies action, and the whole thing just reeks of action. So, subpoint B, terms. We're going to find military response contextually. That's going to be reflected in our plan. So, and then Ebola is just the disease, and everything else is pretty self-explanatory. So, subpoint C, our plan. The U.S. military will send 1,500 personnel and $50 million of aid to West Africa. They are there to build infrastructure, build hospitals, hand out food, control water distribution, and just control the entire process and be on top of that $50 million we're sending them. And then criterion is going to be net benefits. Yes, Lasai?
My first question is, so it's going to be the 3,000 that we're already setting on top of another 1,500, and it's 50 million on top of the 750 million dollars already being spent currently. So that's going to be 800 million dollars. That's my first question.
This is not on top. This is gonna be the new plan.
And my second.
Yeah.
Okay, so the military troops themselves would be building the infrastructure, and what type
the
of
like U.S. It would be the Army Corps of Engineers. It would be doctors. So they're like military personnel who are also engineers and doctors. So they would be running this thing and handing stuff out. Advantage one: stopping Ebola. Subpoint A. Harms. Ebola is devastating West Africa right now. It's the largest outbreak of Ebola ever. There's been 2,630 deaths so far and about 6,000 cases. So clearly, Ebola is just ravishing West Africa. And this is because there's a lack of infrastructure. In America, we have this serum that we can just that we've been given to like 3 or 4 people that we've just cured them of Ebola. And we've given them in hospitals, in safe places. But Africa doesn't have this, and we need to build. They don't have this infrastructure where they can cure the people. They could do it if they had all this infrastructure, but they don't. So our C point we would be building this for them. We would be giving them the medical supplies they need, the infrastructure.
Yeah.
We would be building for them so they'll be able to combat Ebola, which leads me to the impact. First one is just saving lives, you know. Will those deaths of 2,630 will stop Ebola. People will stop dying from it. Second, economics. The more people you save, the more work can get done. They're able to contribute to the economy. If 6,000 people are sick from one disease, that's hurting the African economy. Third impact, preventing it from going international. As if we contain this and we stop it in its tracks, that means that people won't be going out and spreading it across the world or going to other places such as the United States or any other country. And then, again, for the final impact, goodwill towards America. It will show that we're leading the world in medical projects, just like we did with Jonas Salk inventing the vaccine and wiping out polio. Advantage 2, you're in good hands, you can tagline this. Right now, aid packages are stolen. They're not being protected by anything. And African governments are like riddled with corruption. So they'll be they'll be sold to whoever, to just groups of people. So gangs and such. And we can see this like ISIS, how they stole all the aid from the Iraqi military because there was no one to protect it. So B point is there's nothing to stop these people from doing it. The government's corrupt and there's no infrastructure. There's no one watching. So that's where our plan comes in. We'll send our military officials and they will be monitoring it. They'll be watching it. They'll be monitoring every use for it. So our impacts would be money well spent is the first impact. We know that every dollar we send over there is in safe hands. It's going to be protected and it's going to be used on the people. Our next impact is logistical and just efficiency. What we can do is the military can coordinate who gets what, who needs what, how much of it they need, as opposed to just corrupt officials handing it to whoever buys more or whoever bribes them, or however you say. So we'll be able to get medicine more effectively to the people, and yes. So now subpoint C, long-term health. In Africa, thousands of people die every year to diseases that in America, if they had it, they would be cured and they wouldn't be worse for wear. But Africa doesn't have the infrastructure to fight it. So as long as there's no infrastructure, there's no way for African people to prevent getting these diseases and to combat them. So again, our C point is we would build these things and then we would leave them there for the long term, for the future. So when we build a hospital or a kind of a coordinating center, that would stay there and would be able to help the African people, not for just now, but for the long-term future. The impacts of that would be, first of all, think of the children. Africa has a super high infant mortality rate. The children die all the time, and if we can build infrastructures and hospitals, that might not be the case. Then just simple life savings for people now and the future. Again, adults die by the thousands to diseases that are easily cured in a proper setting. And then impact D, it's going to save us money in the long run. Now we have to spend, every time there's an outbreak of a disease in Africa, we have to go and spend money and we give to the relief and we have to pay $50 million and send troops over there. But if we build infrastructure, that means they'll be able to handle these outbreaks before they even start. They'll be able to nip it in the bud and we won't have to pay money or do this. So just to reiterate, our plan is to send 1,500 troops and $50 million in order to build Africa infrastructure and save lives. Thank you.
Yeah, I did this happen a lot of times. You good?
Nope.
Good?
No.
You want me to go? Lasai, you're always good.
No, I'll go first.
He was like, I may not be good, but I'm still good.
Okay. Or do you want to go first?
No, you did.
I'll let you go
I'll,
first.
no, let's back up what you got.
Are you a LO or a always?
On this team, I guess.
Yeah. I think that's probably best to make that.
Okay. We'll change that by the second term.
Blah, blah, blah.
So the side doing the Tom.
The Tom thing.
Yeah, we're sticking to that.
Oh, yeah, the double leap. I think so.
Alright, well, I'm fun.
It's all good.
Beautiful. Alright. 3, 2, 1. Gonna start counter plan, off case, then I'm gonna go on case. Thank you everyone for being here today. I'd like to get straight into this debate because it's very important. First opposition is our counter plan. The text. The World Health Organization will send specialists to Ebola affected areas in Africa to protect public health and safety. And this is going to be sent of 1,500 employees with a budget of $300 million. And so they're going to send equipment, they're going to send specialists, doctors. They're trained to contaminate and reduce viruses and outbreaks and diseases like this from being contagious and spreading. They're going to take their Um, there are other toxins reduction equipment, all that good stuff. And the net benefits to this plan is that we're not going to send any military of the United States. So that's where we get the net benefits from this plan. So for the advantages of our current plan, we're going to see, and yes, question.
How many specialists does the WHO have available at its disposal?
We don't know how many specialists, but we do know that they have specialists and they also have just workers there, like the nurses, doctors, and specialists. But the exact number of just specialists, not sure. But they're just going to send their employees of specialists, doctors, nurses, other trained associates. And so we see that, and yeah, so the advantages that we see from this, that obviously they're going to help decrease the spread of Ebola. They're going to help decrease the deaths from Ebola, and all that contamination. So we do get those benefits too. And so off to our first disadvantage. Our first disadvantage is imperialism. Subpoint A, the uniqueness. Africa wants to currently break away from Western control and dominance that we currently have in Africa. And they want to lean more towards to China, to the eastern side. As we've seen from currently that 100,000 deaths of Africans been killed by U.S. military engagement and aggression in Africa throughout the past couple of years. The link is that their plan is going to incorporate United States military of the amount that they said they're going to send to go into Africa, on top of what Africa already doesn't want them to have. The internal link is that this is going to cause Africa to get even more upset because they want to break away from Western control in their land, and they want to be more helpful from China. So the impacts of this, we're going to see that Africa will get upset, and it's going to decrease the relation and diplomacy between Africa and the United States. We're going to see also increased tension between the United States and China, because China themselves, included with Africa, don't want the United States to have imperialistic control over Africa. Because we've seen many times in the past when the United States sends military and aid to Africa, they like to take their resources and control their resources of money and dominance in Africa. Yes, question.
How will not sending any sort of help to Africa from the United States
I'll get that.
increase
I'll get to that
diplomacy?
later. All right. So the next thing is also that from their plan, they're going to increase the United States imperialism control of Africa, which is going to increase the amount of exploitation that happens in Africa. And we're going to see that Africa does not want these exploitations to occur. And we know that United States, when the United States is going to send the current amount of their plan, troops and military aid, doctors to the United States, that's just the first step. After that, we're like, all right, so we helped you out with Ebola. Now we're going to stay there, and we're going to send more troops to have more control in your land. We're just going to take this and use that to our advantage to make them be more control. And so our second disadvantage is system shock. Uniqueness, subpoint A. Obama currently just stated that they already had a plan to send $750 million and 3,000 troops of military assistance to Africa. And that was the current plan. It was passed by Congress. Everyone was, yes, this is what we agree on. The government. Subpoint B, the link. Their plan is what they said, that they're going to completely remove the plan that Obama just worked so hard to pass, and they're going to send half the amount of troops, and it's only going to cost $50 million. And from this, they're going to jump from $750 million to help out Africa, and now they're going to jump down to only $50 million. And they're going to cut the troops in half, which I don't even see how this plan is statistically, workable. And yes.
How is a system going to be shocked if they haven't implemented the plan yet?
I'll get to that in a little bit. So from this, we're going to see the impacts. They're going to increase confusion within the government, because now the government doesn't know what's going on. The government doesn't know who's in control. They all voted for Obama's plan, and that was supposed to take action. It was already passed, and now it's not. Now it's going to be removed, and they're going to pass a new plan to send less troops, less money, which doesn't really equal, which is going to cause a system shock, because they already formulated $750 million for 3,000 troops. Now we're going to cut $700 million, but we're still going to keep 1,500 troops. I don't see how that's possible with only $50 million, and that's where the system shock comes from. We're going to be scrambling for our money. We're going to be scrambling for our finances. And also, another warrant to this is that a U.S. high-ranking general himself said that sending money to Africa with these militaries is going to cause problems with our budget cuts, with our budget, because we're already seeing budget cuts, and so this is going to cause more confusion and outbreak. So we see that this is going to cause confusion because now they're changing from what Obama currently formulated to only $50 million for 1,500 troops. It's just not going to work out, and it's not going to be effective and efficient. $50 million is not going to do everything that their plan wants to do, which is why Obama wanted $750 million, not just $50 million. So we're going to see that their plan doesn't really get that much benefits. Whereas to our plan, we're going to send the 1,500 employees from the World Health Organizations to help reduce Ebola outbreaks and contagious. Also, to their case, they mentioned on their first advantage how the harms, yes, Ebola is causing deaths, and it is bad, yes, we agree with that. And they said that there's a lack of infrastructure, and he said that there's no hospitals for the victims of Ebola. But that's just simply not true. That's a lie. He's making Africa seem like there's no hospitals, there's no infrastructure. They do have hospitals. They do have infrastructure. They already have people from other countries building hospitals and even building schools. Oprah Winfrey goes and builds schools. So obviously other people are going to build hospitals. We see already engagement from other countries, like the United Nations already sent over 6,000 troops already at the moment to help out with the Ebola outbreak, just for the Ebola outbreak. And also China themselves are sending doctors and specialists to help out with the Ebola outbreak. And China is already spending money to help increase infrastructure for Africa, in which Africa wants China to help them. They don't want the United States to help them. And so they said, so that is already out of that. And like I mentioned, the World Health Organization could do the same thing with their doctors, but they're specialists and they're more well trained for this. And yeah, thank you.
No, you're a good whisperer.
How I sound. So like sometimes I'm too high and sometimes I'm too loud. And I'm paranoid about them hearing when I'm saying.
They can't hear.
I know, you can barely hear me. Probably
No, I can hear you good.
You have the voice
That's
of
good whispers on
anticipated
volume. All right, quick roadmap. I'm going to go in the same order that leader of off just went in, with counter plan and then off case and then case. So our thesis as the government team is that because we believe that saving lives takes precedence over military involvement or economic investment, that the way to do that in Africa is by investing in their infrastructure, and the best way to do that is with the United States military. Now, getting on to their counterplan. Their counterplan is to have the World Health Organization send specialists to protect public health and safety, as well as $300 million. Their solvency is just that now there's no military involvement. So my first response is PERM. There's no competition. We could do both. There's different agents, so we could have the WHO send specialists, as well as the U.S. military sending personnel. But second is when we question them, like, how many specialists does the WHO have at its disposal? Because we're asking, like, how many people can you literally send to train and to treat? And they said they didn't know. But the WHO has employees like nurses and people like that. Yeah, but nurses are not going to help, find the cure for Ebola, and the WHO doesn't have $300 million to spend. In fact, right now they're stretched very thin already, and they've been begging the US and begging other international countries for more money that they're not getting. So the WHO just doesn't have the enforcement capability to do a plan like this, and even if they did, they don't have enough specialists. And even if they do have the specialists, they don't have the resources that the US military has. For example, a serum that we've used to save the lives of two of our own here in the U.S., the WHO has not had access to it. So now, onto their first disadvantage of imperialism. They're arguing that essentially the U.S. is imperializing Africa, and that's going to look bad, and that Africa doesn't like this, and that China's not going to like this. But my first response here is that Africa is asking for it. Nations such as Liberia, who have been affected by this Ebola crisis, are asking for it. Not only is Liberia asking for it, but like WHO personnel and other international organizations like Doctors Without Borders, who are on the ground, are asking for it. Why are they asking for it, though? This is the main reason that we're sending military personnel, is to save lives. They're asking for it because they need lives saved, and they know that there's a lot more that could be done. They just don't have the resources or the infrastructure to do it. My third response is that their counterplan still bites this DA. It's still this, big, largely Western organization coming in with like, oh, more educated people to help you do stuff. So they're still biting the DA, and China's not going to like that. My fourth response is that there's no exploitation going on. In fact, we're sending $50 million. We're not just sending troops. We're sending, or personnel. We're sending personnel and $50 million. That's going to go directly to things like infrastructure, hospitals, command posts, things like that. And my fifth response is basically a disadvantage to their counterplan. So you can flow it on your counterplan page. That their plan has no enforcement for like what if other groups get their hands on this aid or get their hands on these $300 million that is going along with WHO employees. Whereas in our plan we have the military there, so there's no chance that like rebel groups or like another political faction is going to get their hands on our aid that needs to go to the people of West Africa to help them treat Ebola. Their next disadvantage of system shock. Essentially that like because Obama already had a plan and that Congress voted on it, now there's just going to be like all of this confusion and budgetary issues. So my first response is that there's going to be no system shock because we're not doing more, we're doing less. So we're not saying, oh, not only are we going to do this, but let's have tanks and Air Force and all of this. We're saying, no, let's just pare the plan that Obama passed, pare it down a little bit. And why are we doing it? So that we avoid any budgetary difficulties. So when they bring up the example of that U.S. general who says that like helping out in West Africa could give us budgetary problems, that's why we're like, yeah, we see that, and that's why our plan is not $750 million, but rather 50. My third response is that Obama's plan is not yet in action. We don't have military personnel on the ground there yet building hospitals, so it's not going to be that difficult to just say, hey, instead of a lot of people going, we're going to have a little bit less, and instead of all of 750 million, we're going to have 50. No one's going to be confused. And so finally, it's like we're just doing less than what Obama did, so there's not going to be any confusion, and there certainly won't be any budgetary woes. So now let me get to case. I think there was the main case argument that Leader Vop got to was where in our case, our thesis and like our whole case rests on this fact that like Africa, specifically West Africa, doesn't have the infrastructure to help fight and ultimately defeat a disease like Ebola. And Lasai's response was like, well, yeah, they do. They have hospitals and like they have schools. Like Oprah Winfrey built one there. And like, yeah, that's absolutely true. But why did Oprah Winfrey build one there? Because there weren't enough. People weren't getting educated. So an outside source has to come in and help. Another reason, my second response for that they don't have the infrastructure is that WHO and Doctors Without Borders are on the ground there. And every day on NPR, there's a new interview with someone who works in one of those organizations. And they're always saying, we need the international community, and particularly the U.S., to do more. We need more. We need more money. We need more doctors. We need more infrastructure. They set up triage centers in the places that are mostly affected by Ebola, and within a couple days, those triage centers are already overflowed with people, meaning that there's certainly a demand for more treatment and more facilities, and that as soon as something pops up, people who are diseased are then going to go there and try to get treatment. So that's what we're saying. There's a lot of demand for treatment, and we need to meet that demand and have the infrastructure there to meet it. So I think then that we've made the case that there isn't we're not saying there's zero infrastructure in West Africa. We're saying there isn't a sufficient amount to be able to treat and ultimately defeat this disease, which is what we need to be doing. So now getting on to our impacts on our case that went largely unresponded to. The first one about how like we're going to be stopping Ebola. Like look at that, we're going to be eradicating a disease. Like we eradicated polio, and like the U.S. was leading the charge with vaccinations that have led to childhood mortality rates going way down. We now have this serum that we've successfully used to treat our own who were infected with Ebola. And so we're going to be able to, export that to West Africa. They're going to have the infrastructure there to deal with it because our military personnel will be there. So we're going to be saving lives. And just to quantify it for you, let's start with the 2,700 people who are currently infected with Ebola, who are likely not going to make it. We will instantly be able to help increase their quality of life with this serum. And secondly, we have the enforcement mechanism of the U.S. military there to help build infrastructure and give aid and that sort of thing. So whereas their counterplan has no enforcement mechanism in a region that's largely very volatile. So with that in mind, I would like to say vote opposition. Or vote government. Excuse me. Vote
opposition.
Vote government.
Go opposition.
Vote government.
As he said, vote opposition.
He's got a weapon.
I do. All right, so a lot has been said today about the crisis in Africa with Ebola. I think it is mutually agreed that both teams have come up with good plans, and because of the permutation, I think it's clear that our opposing team agrees with our plan, and I'm going to tell you why ours is better than theirs and why. So, just a little roadmap. I'm just going to get into our plan, and then I'm going to connect it with the government's. So, the counter plan is the U.S. will send members of the WHO into the infected areas. As my member of my team said, we are going to be sending a more larger funds and larger number of trained professionals. As the government stated, they wish to send military force. For some reason, they feel that it's going to take a strong arm to cure a disease, when, as the leader of government clearly stated, Ebola is a serious disease that is ravishing Africa. This requires a trained professional, not military force. It does not require a gun. It requires a wetsuit or a medical suit and a trained professional how to deal with this type of situation. I have a lot to cover. Maybe I can get you in a moment. Okay, so the net benefits of our plan are that there are no military involved. As it's already presently happening in Africa, China is located there with medical professionals establishing bases to help, and they are not using large numbers of military force to dominate, or the UN is also has people over there helping medically, not military. So that's why our plan, our counter plan, is more efficient. And so let's go on to some of the disadvantages of the government's plan. As my teammate says, Africa does not want us there. Our opposite team says that they are asking for help, but I have no knowledge of and they cited no sources to them asking for help. As my team member said, generals of the U.S. military are directly saying that military troops in Africa is a misuse in troops. In this current time of financial struggle and world conflicts and all that's going on, this is a misuse of military use at this time and place. Establishing bases and infrastructures. This is just the first step of U.S. establishing military force like they have in U.S. history of all other continents or regions that they have American troops have been present. the first step was, as my opposition team says, you are in good hands. That's how they quoted it. You know, that, what is that, their catchphrase to let us in the door? You're in good hands, you know. And also the leader of government said the military will be there monitoring. That is not solving the disease. Monitoring is not solving. And they also implied that it was the logical choice to do that. Okay, so the leader of government said that there was no infrastructure in Africa. Then the member comes up and said they shift burdens and there's not enough infrastructure. And so they are just changing what they had to say the first time, and it's hard for us as a team to follow along. Long term, the future, children, that's a big point of your guys. But in U.S. history, what has happened? Soon as the U.S. has got their foot in the door in any other country, they start to imperialize and dominate by force, military force at that. That's why our plan is the proper plan, because we do not implement military invasion on any level. So, as Lasai said, $50 million is not enough. For this crisis, it is, as our opposing team said, it is a global risk, and we think that we need to act now. We do not believe it needs military force, and we believe that... okay. So, the member of government talked about a serum that was developed. This serum was not developed by military troops. It was developed by trained professionals in the medical field, which this situation requires. So our counter plan, using the World Health, WHO, in the infected areas, is the proper action to this problem, this global problem, not just a continental problem. It will soon spread at this rate to a global problem, and we need to act with medical and professionals in the field, and we do need to act, in our plan implement that.
You can take my question if you want.
Yeah.
Time. Thanks. So what happens, like, when the $300 million and WHO specialists get to West Africa and they're confronted by gunmen who say, we don't want you here?
They may want to establish their base next to the other bases like the UN's doing. They're not using military force, as I stated. The Chinese are not using strong military force, 50,000 or what, 16,000 troops? Okay, well, they are using troops and nothing in the numbers that you guys are implementing. They do not need the large amount of military troops. That's not what this issue needs. It needs trained professionals in the medical field to train others and get them aware of the risks. I don't know. Sorry, bro.
Yeah.
Okay. So, the opposition has the better, dominant counterplan, and our opposing team acknowledging our perm proves my point that our plan is also good, and I would just like to rephrase that military use is not what is needed for the Ebola crisis. The disease is spreading, and it does not need a gun. It needs a medical assistance. Thank you. Have a good day.
Remember Tom said one debate he had like everybody, because a lot of like people from SEC were watching, so he had everybody knock really hard whenever SEC talked. So like the judges just got a good vibe from them.
Yeah, everyone really liked that.
Yeah. That was a good job. Got enough to cover all bases.
Did I counter the perm correctly? Is that how you're supposed to counter?
Yeah. You did you mentioned how like we don't have any troops, and so that's why it's not
And
good
the solvency.
yeah, not good to pass both plans. Alright, got all my papers. Yeah.
Okay. Oops.
All right, did I get 4 minutes or 5?
Four. I get 5.
All right,
Yeah, correct.
5.
No,
No,
you get
4.
four.
I get
Yeah,
4.
yeah.
All right, 3, 2, 1. All right, so I'm gonna go over some of the arguments, cover bases. I'm gonna go straight into my voters. So, like we did mention, how that we already talked about their plan. How we said that there's already troops coming from China and United Nations, like I mentioned in the first speech, and then so how that's already non-unique for their plan to send more troops of 1,500. And they said that there was no infrastructure, but we said there is infrastructure, and there's going to be more infrastructure because we have other international communities getting involved, and we have other organizations building infrastructure, like we mentioned. Example for of China and United Nations, we brought those warrants in with us, so we see their plan is non-unique because these things are already being done. And we also touched bases on how their plan. Okay, so yeah, so now I'm just going to go to the next part on our imperialism argument. Their responses were that the counterplan bites the DA, but it doesn't bite the DA because it's not United States and are sending troops in there. They said that China. They also said Africa is asking for help, but not all of Africa is asking for help. Africa is a huge freaking continent. Not everyone agrees. Not everyone in the political dominant power agrees for the same actions. And one of the other responses was that China's not. They agreed saying that China is not going to like. China's not going to like. They said that China's not going to like the World Health Organization and that they're going to get mad. So if they said they're not going to like the World Health Organization, which is severely less imperialism dominance than the United States, then they are agreeing that our counterplan is true. So from that saying that our counterplan is true of imperialism, we see that yes, we see that that they agree that China will not like United States military involvement, and so we see that our impacts are inherently true. We see that it's going to cause increased tension between the United States and China, which is really bad. Like we said, from all of the other distractions that the United States have, throwing China into the mix, that's not a good scenario. Also, with Africa increasing tension between Africa and the United States, diplomacy, we see that that's not good as well. And how we did mention that from them sending this amount of troops now, I mentioned that that's going just to lead for the future for America to already step and send more troops, how I mentioned, and that wasn't really addressed. So we see that their plan is going to involve future troops to go into the Africa, which is going to just overall create exploitation in Africa. We're going to see the United States having more influence and more power, more control, dominance over Africa from what they already currently have. Like I stated earlier, with the troops already there and killed 100,000 Africans by United States involvement. And how I did mention that when the United States does something for Africa, they want to get something in return, so that's how they exploit them. And so we see that imperialism does go through. Another thing for the system shock, they said that there was going to be no system shock simply because they're decreasing money, but that's not true. I mentioned in the first speech that the original plan was 3,000 troops, $750 million. That was well written out, thought by a lot of economists and whatever government officials. But now they're cutting the troops by half. All right, that's pretty cool. Cutting the troops by half, save us some money. 1,500 troops out of the 1,000 troops. But now it's only going to be $50 million. How do you go from 3,000 troops to $750 million to 1,500,000 troops to $50 million and still run an effective plan that supposedly is going to help effectively, immediately getting rid of Ebola? I don't see how that's going to happen, and that's why the government's confused. They're shocked because, well, how are we going to disperse the $50 million for 1,500 troops and infrastructure and time and engagement and resources and tools like equipment and medicine? So we see that their plan is just inherently not really effective, like we mentioned from all the arguments. So now I'm going to go into the voters, which I lost the paper. Okay, voter number 1 is our counter plan, in which they inherently agreed that it's good and it has advantages because they said they're going to permit and try to pass it. So they want to pass our plan, which means that you should vote for our plan, in which we said we don't want to pass their plan for the disadvantage of the system shock and the disadvantage of imperialism. So we see that our plan should be passed because the only plan that is agreed on from both sides. Voter number 2 is that their plan, they said that they agree that's going to bring imperialism because China will not. They agree to the impacts of China by saying China will get mad and they won't like it. So we see that all the impacts get flowed across. Voter number 3 is the system shock. Their plan is not going to be effective because it's only $50 million for 1,500 troops when we originally wanted to spend $750 million. So I don't see how their plan is going to get anything effectively done. And so our first voter issue is that we see little impacts being solved from their plan, in which our plan has better impacts. Thank you.
Y'all ran regular speed time?
Yeah, we're not supposed to.
And it's only 12:11. Okay, I forgot about that. We did full time.
Okay, thank you for coming, everybody, and I hope we can finish up this debate on a good note. Okay, so I'm just going to respond to the new arguments they brought up, and then I'm going to talk about some voters and the two worlds. So first off, I just want to address their shifting burdens argument, because they said that I said that Africa had zero infrastructure, and then my partner comes up and explains, no, they just don't have enough infrastructure. I said that Africa doesn't have the infrastructure to handle their Ebola crisis, which 2,600 dead seems like they don't have the infrastructure to handle it. And just because they have some hospitals doesn't mean they have infrastructure in place to deal with these medical crises, the biggest in history. So clearly they don't have the infrastructure, and I don't think there was any verbiage that says, oh, I talked about they having no hospitals. I just said they didn't have the ability to handle it. Second, okay, so now I want to get into their point about imperialism and how this is just the first step into, I don't know, staying and abusing Africa forever. The United States, when they send doctors and especially the Army Corps of Engineers to build up infrastructure and to help people, they don't stay. We have a record of not staying. The Panama Canal was built by the Army Corps of Engineers, and have we colonized Panama? No, we gave it to the people, and now we built it. Yeah.
Does Panama have any natural
Oh, there are no
resources?
questions.
Oh, sorry.
It's not a point of order. So, like we saw in Panama, we can go and help a group of people, and then we can step back and leave it to them to help improve their economy, to help shipping come through Panama. And that's essentially the same thing what we want to do with West Africa and Liberia. Okay, so now they say we have a system shock. But again, my partner addressed this thoroughly. How can a system that hasn't been put in place yet cause shock? We're just going to tell them, hey, hold back a little bit. And I don't think anybody will be shocked by that, unless they're shocked about how much extra money they have to spend, which I think that's a good surprise that they'd like. And then I'm going to address finally the perm. The perm that my partner did, there's no competition between the plans. If the World Health Organization can send people and the United States can send people, why don't they do both? Even though they claimed the disadvantages to our plan kind of made the perm okay, there's still no competition just because they think our plan has negative effects or negative consequences. So nothing stops us from doing both. Okay, so to get into the voters, what our plan does is we stop Ebola and we make sure that Africa, and we set up Africa for the long term. So what we do, voter number one is stopping Ebola, saving lives, helping and that saves lives, and it helps the economy, and it prevents it from going international. Because if we stop Ebola, then we prevent all those things from happening. Voter two, if you think that the World Health Organization can be robbed by like groups of militants that Africa has. Africa is a notoriously violent place where lots of the aid goes and immediately gets lost either due to corruption or because political parties are fighting each other. So they have no ability to contain so all the money well spent and efficiency and helping out people in the best way possible goes to us. And then finally, long-term health. Their plan does nothing to address the long-term concerns of the people. What we do is we build infrastructure, it stays there and it will help for generations upon generations. Okay, so now for the two worlds. One world with our plan where we can do both, where we can have the World Health Organization and the United States go solve this problem, and the only thing that's shocking is how much extra money the United States government has. And to their plan, the second world would be a world where all the aid could get lost, where there's no sort of enforcement, and where we don't help anybody for the long term. So if you want to, and by sending, we send over supplies that the WHO doesn't have and that they can't even come up with. So they can send non-existent help to Africa, or we send real help with real solutions.
Let me
Solid.
turn on recording. Oh, you guys
Dude, I went
recorded?
up there with like
We
5
didn't
minutes
record
of
ours.
prep.